All right. Hello, everyone. So today we're going to be talking about medication use and what medication is, how to use it, and all the different types. Okay. All right. So why are we here today? So after viewing this program, older adults and their caregivers will be able to discuss the general risks and benefits of medication therapy, the differences between prescription medicines and over the counter, which is non prescription medicines, common medicine use problems, and ways to improve medicine use safely. So, medicine benefits. What is a medicine? A medicine or drug changes how your body works, or it treats or prevents a disease or symptom. So, when used correctly, medicines can lead to a better life quality, a longer life, and a healthier life. All right, so types of medicines. First is prescription medicine. So, the examples would be blood pressure medications, blood thinners, antibiotics, and eye drops. And then the other is over the counter or non prescription medications. So this would include aspirin, cough medicine, Tylenol, things of those nature. And for all medications, you must read and follow the instructions. All right, so what's the difference between prescription and non prescription? Well, for one, a prescription is prescribed by a healthcare professional versus over the counter is self prescribed. And a prescription should only be taken by the patient that it's prescribed for, versus over the counter, like I said, because it is self prescribed. You decide what you need and go from there. What both have in common is both can cause drug interactions and both should be reviewed by your healthcare team. All right, so some dietary supplements and herbal remedies. Typically, these are self prescribed, available from many sources, and you're responsible for choosing the correct medicine, dose, and for watching for side effects. Now, herbal remedies do not have to follow the same strict rules that prescription drugs do. For herbal remedies, manufacturers do not have to prove that the drug is safe, effective, or that it contains the ingredients on the label. So, some risks and medications. It's very important to know that all medicines, both prescription and over the counter, have risks as well as benefits. So, the risks of medicines are the chances that something unwanted or unexpected could happen to you when you use them. So, risks can be less serious things such as an upset stomach, or more serious things such as liver failure. All right, so continuing off medicine risks is medicines can cause problems even if used correctly. They can cause an allergic reaction, which is when your body's defense system reacts in a bad way. And some reactions can include hives, itching, rash, narrowing of throat, difficulty breathing, or even shortness of breath, versus the side effect, which the side effect is just an undesired effect of the medication. So some side effects are common, which include headache, upset stomach, and then there's others which tend to be very rare, which include liver failure. So side effects can occur even though the medicine is being taken correctly at the normal dose. So it's very important that you do notify all healthcare providers of your medicine allergies. So some common side effects are listed here, which include drowsiness, dry mouth, aches and pains, restlessness, nausea, dizziness, chills, fatigue, and sometimes confusion. All right, so in the system, there's actually an allergy information and it's listed in your home care plan of care. And your home care plan of care can be accessed from your schedule. So right where you see the arrow, so this can be found, again, if you need to review it, it is on our website, how to clock in, how to view your schedule. But at this point, you guys have been here long enough to should know this. But in case you don't, the allergy information is listed here. You just click the HCPOC and you will see this. NKA, that means no known allergies. So this specific patient does not have any known allergies, whereas NKDA means no known drug allergies. All right, so medicine use problems. What are medicine use problems? Medicine use problems are any bad things that can happen to you as a result of taking only one medicine or several medicines. Medicine use problems can result in you're not getting the best results from your medicine. Medicine use problems can prevent you from getting well as fast as you would like to, make you sicker, lower your quality of life, or can cause disabilities, accidents, or injuries. So some potential medicine use problems. Overuse, taking more than prescribed or recommended by the healthcare provider or label, and taking unnecessary medicines. Or there's underuse, which means taking less than the prescribed or by missing or skipping doses, not following instructions for use carefully, and drug interactions. So continuing off drug interactions. So drug interactions occur when a drug interacts with another drug, food, or alcohol and changes the way that the drug acts in the body. So it may cause unexpected side effects, and the drugs involved can be prescription, over-the-counter, or even vitamins and herbal products. So some examples would be warfarin antibiotics, warfarin and green leafy vegetables, alcohol and pain medications, selective serotonin reuptake inhibitor antidepressants, and then grapefruit juice and multiple medications such as amlodipine and other blood pressure medications. So when can medicine use problems happen? Well, it can pretty much happen when a new medicine is added to your routine, when a medicine is stopped, when a dose of medicine is changed, when alcohol is consumed while taking the medicine, when over-the-counter and herbal products are taken without the doctor or pharmacist knowing that they're part of the medicine routine. And you guys, it can really happen at any time. So are there ways to avoid medicine use problems? Of course. So the first one would be communication. Asking questions to increase your knowledge, talking to your healthcare provider, and always keeping an updated medicine list. Second, using a one pharmacy for all prescription medicines. And then third, it's just a medicine review. Check your prescription prior to taking, and then have your medicines reviewed at least annually to make sure that you need to be continually taking them, or maybe it's time to get off of them. Know your medicines, you guys. What is this medicine used for? Is it brand? Is it generic? Where do you store it? How do you take it? How much? How often? What time of the day? With or without food? With or without other medications? What should you expect or do? How do I know if a medicine's working? What are the possible side effects and what should I do about them? Are there tests or monitoring needed? And then what happens if I miss a dose? So this is all very, very, very important to know your medications. Now your medicine list. When visiting any healthcare professional, take your medicine list, which contains the information on are your prescription medicines, including eye drops, topicals, and samples, non-prescription medicines, herbal, and vaccines, what you're taking the medicines for, and how to take the medicine. Now make copies of your list. Give one to your doctor, one to your pharmacist, and one to your loved one. And just carry one with you and keep a copy at home. But it's very important to keep it updated. All right, talking with your healthcare provider. Prior to your visit, make a list of questions you might have. Ask about questions you might have about a disease, symptoms, or medications, the need to continue current medications, non-drug treatments, over-the-counter preparations, and then a need to follow up or do lab work. And remember, you guys are a very, very, very important part of your healthcare team. So ways to avoid medicine use problems. The over-the-counter drug fact label. So all over-the-counter medicines in the United States have a drug fact label that looks like this. Learning to read the drug fact label will give you the knowledge to make better decisions and to be able to use the over-the-counter medicines a lot safer. So reading the over-the-counter drug fact label. Active ingredients. Active ingredients are the chemical compound in the medicine that works with your body to bring relief. Uses. This section tells you the only symptoms the medicine is approved to treat. Warnings. This section obviously tells you what to avoid and who should not use this. Directions, recommended daily dosage and frequency. This needs to be followed very strictly. Other information just gives you any additional information, such as proper storage. And then last is the inactive ingredients, so which is the chemical compounds that have no effect on your body. So ways to avoid medicine use problems. Written information. The information sheet you get with your prescription medicine contains very useful information to help you get the best results and to avoid any problems. Make sure you read it very carefully. The information sheet tells you what the medicine is used for, how to take your medicine correctly, what side effects to watch for and what to do if they occur, warnings and precautions, and then any storage tips. So let's review. Remember the 3 R's for safe medicine use. First, risk. All medicines, prescription and non-prescriptions, have risks as well as benefits, and you need to weigh these risks and benefits carefully with every medicine you take. 2, respect. Respect the power of your medicine and the value of medicines properly used. And the third, responsibility. Take responsibility for learning about how to take your medicine safely. All right, medication route. So medications get into the body in a number of different ways. The most common would be orally in the form of pills, capsules, or liquids. However, if the person is unable to take it in this way, or the medication just might not be available in oral form, medications can enter the body by other routes. All right, so some popular common routes would be, or I guess all the routes really, oral by mouth, sublingual is under the tongue, nasal into the nose, eyes directly on eyes, ear directly into the ear, transdermal is through the skin, topical is directly to the skin, subcutaneous is under the skin, enteral is through a feeding tube, rectal is through the rectum, and then vaginal is into the vagina. So some do's and don'ts. Do bring medication from the pharmacy. Do read the label to the client. Do open the medicine bottle. Do open proper slot on the pill box. Do bring water and supplies, and do call the office and ask questions. Now, don'ts. Don't decide what over-the-counter medicine to buy for your client. Educate or give advice on the client or the medicine. Don't take medicine out of the bottle with your hands. Don't take medicine out of the pill box with your hands. Don't administer medications through any routes, and just don't assume that it's all right, even if the client asks you to do so. Skilled nursing services. Nursing services to assist clients with their medication is one of the covered services under CCSP and SOURCE programs. So typically, nurses come to the client weekly to assess the client's condition and compliance with the medications, reconcile client's medications, and report any issues to the client's doctor, pre-fill the client's pill box or insulin syringes, educate client about the medication routine and answer client's question. And in special circumstances, nurses may come to the client more frequently than once a week. Some aides can be allowed to administer medication to their clients after they received one-on-one education and were deemed competent by the licensed nurse. All right, you guys, you are our eyes and ears. Look for something unusual or something that just doesn't seem right. Our nurses and therapists 100% rely on you. Call the office with any questions or concerns you might have. We always can reach a nurse for you. We have a nurse in the office during the day and always have a nurse on call after hours as well. Our clients need you every day so that they can stay in their homes as long as possible versus going to the nursing home. Because remember Medside's slogan? Because being home is always better, right? Remember, you guys are the most important part of our healthcare team. We need you. We're very thankful for all that you do, and please continue just doing a great job. All right, you guys, so some resources that I have used and that we've talked about today. Some safe medicine use information can be found at these sources. Buying medicine safely on the internet can be found here. And yeah, that is all that I have for you guys. So thank you so much for tuning in and for listening to this medication program. Thank you, guys.